What's going on, everyone? Good morning. Dr. Todd from Move Well. I know we haven't done a Facebook Live in a while, and it's because you can kind of hear my voice. I had lost my voice for a week. It's almost back. Okay, great. It's been really hard seeing patients whispering, but voice is almost back, and I wanted to do a cool topic, and the topic is, I'm reading this on the board, I'll flip it around in a second, chiropractic functional movement. Do I really need to know this stuff? I'm gonna talk about the hip hinge, but first off, if you haven't already, you can grab a copy of our book, Move Well Secrets. You can get this for free, just cover shipping. Go to movewelluniversity.com/book. We'll send this out to you. We send out a ton of these books in the last month, and so we're on a roll. It's awesome because it's showing that there is a huge interest and a demand for our fellow chiropractors who think that we should be doing some level of functional movement, corrective exercise in office, or at least knowing this enough to talk about it with patients, advise patients on this. Grab the book. It's an 18-chapter overview. It's a quick read, and it's something that I think just gives you a little more clarity of like, how do you do this in a chiropractic model at all? And then another little update that's exciting is there was a gym here locally that was going out of business, and I just happened to see this on Craigslist, and I picked up some stuff from them that I've been wanting to add to my home gym. It was small enough so that it fit, and I have a couple more things that are coming for the home gym, so I'll just show you real quick, okay? I'll flip this around, tell you what we got. All right, so we've had dumbbells that went up to 100. We've got some 110s. How cool is that? Got our kettlebells, of course. All right, we're trying to incorporate kettlebells into each and every training. We've had this functional trainer. I know some of you are like, that's not functional, leg press. I've always liked doing leg press to some extent. We got our own leg press here, which is great. This is not what we do primarily for legs. We're doing lots of squats and front squats and deadlifts. We got this safety squat bar, Rogue safety squat bar. Happy about that. We got this fun one right here with the different grips. And so anyway, and we always have these bumper plates. And then lots and lots and lots of plates to load up heavy stuff. So, not to say I'm doing 720-pound deadlifts, no I'm not, but mostly for leg press machine, have enough weight on there. So, let's flip this around. We'll talk about the hip hinge and how this comes up in practice and why you need to be talking about this, because it's really, really important. So, hopefully, everyone can see me on here. All right, so let's see. I had to flip this around so you can see it the right way. All right, so I just showed you a little tour of the home gym here. This is not what it looks like in a chiropractic clinic by any means. You don't have to have all this weightlifting equipment and powerlifting stuff. This is just something that I really enjoy doing. I did years of bodybuilding, and now I'm moving more into strength and power and functional fitness, so getting strong again, but I like to use kettlebells so I can maintain good mobility and stability and do this for a lifetime and actually have fitness be a healthy thing and not where you're working out becoming more dysfunctional. And the thing is, a lot of your patients who are exercising or working out, they don't have the guidance or the know-how to make sure that their fitness routine is actually reinforcing health. Instead, they might look aesthetically good, they might look lean, might have good muscle mass. However, their movement patterns might be garbage, and they might be getting injured in their workouts. And so if you can speak this language to people, you have two types of people out there, really. Well, maybe three. You have three types of people out there, and this is why this even matters to begin with. You have people who don't exercise at all, but they know they need to and they want to, but they don't know how to transition into it. That's a lot of people, all right? That's why talking functional movement, addressing this in practice is huge, because you speak to that population, which is a lot of people. Second is you have people who already do work out, all right? They're working out, they've injured themselves several times, and they want guidance on how to do it better. And then you have the third type, which is maybe very, very small population who actually is doing more functional type of training type stuff, put it up enough, get into more strength. So you have these three types of people, okay? So those who don't work out who want to, those who are working out dysfunctionally and injuring themselves, and those that are working out in such a way that they're not building any strength at all. They just do, very, very easy, simple stuff. They think that's what they're supposed to be doing, very light, and they don't understand that building strength is what's actually going to make them even healthier as long as it's done in a functional and safe manner. And you can be the one to transition of doing that using the protocols that we lay out inside of MoveWell. Okay, so there's actually a fourth category too. People who are never going to exercise, they don't care, and all this stuff's going to go in one ear and out the other. But believe it or not, that's a very small part of the population. You might think that's bigger than it is. It's not. It's that people don't know how, and you're not speaking them in such a way that motivates them to do so. Now, why does this matter in chiropractic? Well, one is we are healthcare practitioners. We're trying to get people healthier, right? Two is, why not capitalize on the fastest growing industry in the world, which is the fitness industry, all right? It's huge. This is one of the things that slapped me in the side of the head several years ago and said, why aren't we addressing exercise in our practice? People flock into gyms, into group training type stuff because they want this. Whether or not they follow through or not, they want it. You need the systems to keep them motivated so they follow through. We built all that. It works. We have this thing called the 12-week transformation. We have an online portal. We have a journal that patients go through. So it keeps them super committed to fitness and getting healthier in their movement. And then it couples it into chiropractic, into segment and posture, which is what we do as chiropractors. So you have a segment, posture, movement model. It encompasses all of these things, takes chiropractic, which is what everyone needs, and then takes movement and fitness, which is what everyone wants and is very popular, molds them together, gets amazing commitment, builds a culture, and at the end of the day, boom, you have like the perfect formula for fun in practice and speaking to what your community wants and getting your foot in the door anywhere you want to go because you're speaking the language that everyone already knows and wants, which is movement, fitness, strength, power, all that good stuff. Okay, so with that said, do I really need to know this stuff? Hip hinge. I drew a little picture down here of someone hip hinging, actually driving the pelvis back, okay, and having a good hip hinge pattern, like a deadlift. And then on this side, I got lightning bolt to the low back because they're not increasing their hip flexion or at least maintaining a good neutral spine. They're not driving with their hips coming backwards. They're rounding the lumbar spine. Their knees are shifting way far forward because they lack ankle mobility. They're coming up on their toes. This is how most people move and how they bend, okay? And if you did a movement assessment, you would notice that. So as a chiropractor, do we know how to fix this? Maybe as a chiropractor, we say, oh, it's all stuff is tight. It needs to be adjusted, it needs to be mobilized, and then it's gonna fix them. That's not the right answer because that doesn't work. That's a piece of the puzzle, but that's not what fixes them. People can't do this for multiple reasons. One could be joint restriction, absolutely. How do you find that? You do an assessment. What type of assessment do? You do one that doesn't take you 45 minutes. So if you're following any of the popular movement assessment stuff out there, that's how I got into all this stuff. I trained in that, I learned it, and I was more frustrated than when I started because I realized this is not set up for a busy chiropractic clinic. There's no way you're gonna be able to do this in a timely fashion unless you wanted to see like 3 patients a day. So we had to design our own systems to figure out how do you do this quick, to the point, figure out what to do with a patient, and then have good knowledge to say, this is the intervention I'm now going to do, then have a way of assigning this to staff that's already trained up so you can say, do this protocol, this one, and this one. They know exactly what to do so that if you're the kind of doctor that just wants to stay in the adjusting room and adjust patients all day while you have an exercise department and carry this stuff out, great. If you're the kind of doctor that wants to be involved in it as well and you're in the mix, that works too, and you have staff assisting you. Either way, both models work very, very well with this. But it's the programming, it's the know-how, it's the assessing, knowing what to do to correct it, how to implement this in your practice, how to keep patients engaged, understanding it, tied in with chiropractic, how to manage all of this stuff so that patients can see there's checkpoints, there's a beginning, middle, end, and it fits into a beautiful system. I'm not the smartest guy in the world with all the clinical stuff. I know quite a bit. I think I'm very good with it. But my expertise or my gift in this is systems and protocols. That's how my brain works. That's how we've developed all this stuff. So the system to getting someone fixed here is we got to figure out what joint, muscle, or brain issue is there? What joint restriction is there that's going to benefit from chiropractic or different corrective exercise approaches? Okay, because sometimes a joint needs to be adjusted, but then you need to work on tracking the joint, and that could be like a joint mobility protocol, not an adjustment, not a quick high velocity explosive type thing that we're having people do on themselves or anything like that. But for example, ankle mobility. Someone could have a subluxated talus. Maybe they had multiple inversion sprains to their ankle. Their talus is subluxated, fixated. So we're setting the talus. Okay, we're getting good joint range of motion of the talus. But now you have all the posterior musculature on the back of the calf that's tight, compensating. You have a joint tracking problem. Maybe they have foot flat or foot turn out, so the knee doesn't track the second toe when they come forward into a lunge or a squat position. So that whole ankle joint isn't tracking properly. So you retract that by trying to teach them how to hold the foot in a healthy, neutral, somewhat supinated position while the knee is tracking properly in the joint. So you adjust, you teach them that protocol, okay? But before you even do that, you gotta work on mobility with usually the soft tissue stuff first if that's involved. Doesn't mean you gotta be digging on the person for an hour. I'm not talking about opening a chiropractic massage clinic, okay? That's not what we do in our practice. But it's teaching patients what's a self-administered technique that you can be doing on your own, using a double lacrosse ball or a J-cane or a foam roller, all these different tools. But also too, with the tools, that's not the solution, that's the beginning point. If you don't reinforce the healthy patterns and actually do a functional movement like a hip hinge or a loaded hip hinge, which is a deadlift, you're not getting anywhere. And now at that point, you're doing very basic intervention that's not evidence-based for long-term corrective results. Okay, so it has its place, these tools have their place, but it's not the end all. It's not the stuff you see on YouTube or Amazon or whatever, like selling this stuff like, hey, you just dig in your muscles and it's gonna fix everything. No, that's actually step one of a 5-step clinical approach that we take with our patients. So it could be a joint issue, could be a muscle issue, could then be a motor control issue, a brain issue, just not knowing how to execute the movement, how to coordinate the movement. So there's ways to pattern that and train them. And then from there, once you do that, how do you load that? Well, you load that by teaching deadlifts. How do you do a safe deadlift on an 85-year-old patient? There's ways to do it. We do it. We use kettlebells typically to start to reinforce this. Maybe after we've done it banded. Like yesterday, I jumped in the exercise department. I was helping a patient of ours who came in with horrible acute low back pain. That's how he started with us. And he's learning kettlebell swings now very safely. It's in probably his 8th or 9th week of care. So he's gone through all of these other foundational exercises to address mobility and stability, making sure his joints, muscles, everything is safe, making sure he has good control of core, understands things like a deadlift pattern way before we'd ever put a kettlebell in his hand, and start to now show him a basic swing. But why are we doing this? Engage the posterior chain, get balance and coordination, get activation going. The guy loves it, he's doing awesome, he's doing better than he's done in years, and it's a combination of all the approaches. So hip hinge, super important. Every single one of your patients should be learning how to do a hip hinge, especially a low back pain patient that comes in that throws up their low back. If we're not teaching this, we're not fixing them. And if you want to roll the dice and think that a personal trainer or a physical therapist or someone else is going to fill this role, a lot of your patients aren't seeing PTs or physical therapists, PTs or personal trainers. Lots of PTs, physical therapists, even though they understand this and they know this, it's not in their protocols to do. Why is that? Because they're handcuffed by the doctor that refers the patient to them by, here's your diagnosis, here's what you can work on. Yeah, it's a full body movement pattern, that's what you should be looking at, but you're only gonna work on improving range of motion of the hip joint. How are you gonna do that? Oh, we're gonna do a bunch of manual therapy and stretching. They don't even follow that 5-step approach that I'm referring to, which is what we base all of our clinical model on inside of Movable University. It's how we do with our patients. It's a 5-step approach, which we talk about a little bit in the book. We talk about way more inside of our program. By the way, if you have not grabbed the book yet, you can grab this. Go to movableuniversity.com/book. It's free. We'll send it out to you. You cover shipping, okay? Ultimately, how this is gonna work is you could be a chiropractor who watches this, who resonates with what I'm saying, and you're like, yeah, I'd love to do this in my practice. Grab the book, there's an online portal, a digital portal that comes with this. Okay, it's free. So when you go through this, it takes you through a couple pages online, gives you access to an online portal. Watch that stuff. It was a couple weekends of work where we map out a lot of really what we put into the 18 chapters of the book in video format. Okay, explaining and talking about the thought process. It'll get you excited about this stuff. I promise you, okay? And if it doesn't, you're not the right kind of chiropractor that cares about this. You're probably not watching this video right now. But grab the book, get the digital, that digital portal. Then the next step from there, reach out to us, okay? Contact us anytime, send us a message on Facebook. It's not hard to find us. You can go to moveuniversity.com and there's like some places where you can set up a demo call with us, some contact. But then from there, what will happen is that if you want us to demo and show you behind the scenes of Movable University, we can set up a time to do that. We have one person on our team, Vlad, who is dedicated to doing these demos. He does them all week long with doctors all over the country, okay? So there's always resources we have to show you the big picture, to kind of give you like the behind the scenes of how we do this in our practice without you necessarily having to fly out to our clinic right now and say, I want to see how you guys do it. But how we do it, it's a finely tuned machine. It's a ton of fun. I love it. Patients love it. We're super excited about it. The hip hinge is something you should be showing all of your patients. And if you don't have time to do it because you're in the adjusting room, empower your team, your staff, have them work to help your patients and work in synergy with what you're doing in your segmental approach by addressing some movement patterns. It's super important. So with that said, I'm gonna cut this off here. Comment, question, whatever you want below. Share this with other chiropractors who you think could benefit from this. Grab the book, go to the website, and we'll see you soon. My voice is almost back, so excuse my raspiness, but this is after a week of having no voice, which for a dude that talks a lot like me, that's hard, okay? But something out in the universe was telling me I needed to be quiet for a while. So we're back. Hopefully my voice is even better tomorrow. We got some exciting news of what we're releasing tomorrow that we've been working on for the last 3 weeks. So stay tuned for that, and we'll talk soon. So over and out.